Hey everyone, welcome back for this deep dive where we're tackling something that's, well, essential for life, breathing.
That's right. And more specifically, we're going deep on COPD. We've got a really interesting mix of materials for this one.
We do. Medical summaries, which, let's be honest, can be a little dry, but also this really cool guide for patients called Better Living with COPD.
Definitely designed to make sense of it all.
Exactly. Because who's got time to wade through jargon, right? So we're giving you the good stuff, clear and concise. And I gotta say, Better Living does this awesome job right off the bat, explaining the whole respiratory system. We kind of take breathing for granted, you know?
I know, right? It's like this whole intricate world happening inside us every second.
Totally. And the way they describe it with the bronchioles and the alveoli, I mean, it's pretty wild when you really think about it.
Oh, yeah, they say it's like imagine thousands of tiny branches in your lungs, and at the end of each one, these tiny little air sacs.
Thousands. Seriously, that's
Yeah.
a lot of branches.
Right. It's like a whole forest in there. And those air sacs, those alveoli, that's where the magic really happens.
The magic meaning like oxygen getting into our blood.
Exactly. It's like this super efficient exchange system. Oxygen from the air you breathe crosses into your bloodstream, and at the same time, the carbon dioxide waste from your cells is going the other way into those air sacs so you can breathe it out. Pretty amazing, huh?
Wow, when you put it that way, it's like, wow, our bodies are incredible. So, where does COPD come into all of this? Does it mess with that exchange?
It does. The A Quick Guide on COPD source we have explains it as basically the airways get really irritated and inflamed, and that makes it harder to breathe.
Constantly irritated? Like,
Oh.
ouch! That makes me think of having a sore throat, but it never goes away.
That's a great way to think about it. That's essentially what's happening with COPD. That constant inflammation makes the airways narrower, so it's harder for air to flow through.
Like trying to breathe through a straw all the time.
Exactly. And it's not just one thing either. A quick guide points out that COPD is more of an umbrella term,
Umbrella term, meaning like,
meaning it covers a couple of different conditions. Chronic bronchitis, which is that constant irritation of mucus we were just talking about. And then there's emphysema. And with that one, those tiny air sacs, those alveoli, they actually start to break down.
oh wow, I didn't realize it was both of those things. So you could have either one or even both at the same time.
Exactly.
Okay, so that definitely explains why it can be so complex. But hey, that's what we're here for, right? To break it all down. So we've covered a lot of ground already, but I'm thinking, okay, how would someone even know they have COPD? What are the signs?
That's a great question, and it's actually something that both of these sources touch on. A quick guide uses the phrase subtle symptoms, which I think is really fitting
It seems really
because,
obvious, right?
right, like you might just put it down to getting older or something
And
like that.
totally, like, oh, I'm just out of shape. I need to hit the gym more.
Exactly. A quick guide gives the example of someone who used to always take the stairs, no problem, and now they find themselves opting for the elevator more and more.
Yeah, been there.
And it's like, is that just age or is it something more? It could be a sign of COPD.
Wow, I never would have thought of that. It's kind of scary how easy it is to dismiss those little things.
And that's why early diagnosis is so important, right?
Makes sense because if you don't even realize it's happening.
Exactly. It's not just about managing symptoms at that point, it's about potentially slowing down the progression of the disease.
Gotcha. Okay, so let's say someone is experiencing some of these symptoms. Maybe they're starting to get a little concerned. What's the next step? How is COPD actually diagnosed?
Well, both Better Living and a quick guide mention this test called spirometry. Have you heard of that?
I have, but I have to admit, I don't really know what it involves.
It's actually a very simple breathing test. You basically just breathe into a tube and it measures how much air you can exhale and how quickly you can do it.
Okay, so pretty straightforward.
Exactly. But don't let the simplicity fool you. It's super useful because it can actually detect COPD even before you have really noticeable symptoms.
Wow, so it's like a heads up.
Exactly. Early warning system. Gives you and your doctor a chance to make a plan, potentially slow things down before it gets too far along.
I'm all about early detection. So thinking about those symptoms again, it's good to be aware of what to look out for. What are some of the common ones that a quick guide lists?
Well, the big one is going to be that persistent cough. If you've got a cough that just won't quit, even if you don't feel sick, that's definitely something to pay attention to.
Yeah, that's not something you want to ignore.
Nope. They also mention shortness of breath, especially with activity, and that can kind of sneak up on you too, right? You might just think, oh, I need to get back in shape, but it could be something more.
Right, like that whole stairs versus elevator thing.
Exactly. And then wheezing is another one, that whistling sound when you breathe. Some people experience chest tightness too, like there's a weight on their chest. Again, all things you don't want to ignore.
Makes sense. So what happens if you're diagnosed with COPD? Is it just a matter of managing the symptoms, or are there things you can do to actually, I don't know, get better?
That's where things get really interesting, and that's where Better Living with COPD really shines, I think, because it emphasizes that this is not a dead-end diagnosis.
It's not just about limitations, right? It's about, like you said, living better.
Exactly. And both sources are very clear that if you smoke, quitting is absolutely paramount. That's like step 1, step 2, step 3.
Non-negotiable.
Exactly. And then there's this whole other side of it, which is pulmonary rehabilitation. Have you heard of that?
I have. Better Living talks about it quite a bit. It sounds kind of, I don't know, intense.
It can be. It basically involves education about your condition, exercise training specifically designed for people with lung conditions, and then there's a big support component too.
So it's not just you on your own trying to figure it all out.
Not at all. You're working with a team of healthcare professionals, learning how to manage your COPD, improve your breathing, and just overall improve your quality of life.
That's what I love about this approach. It's so holistic. It's not just about your lungs, it's about everything.
Absolutely. And speaking of holistic, something else Better Living talks about that I think is super important is the idea of a personalized COPD action plan. Basically, it's like a roadmap. It outlines your daily medications, what to do if your symptoms start to flare up.
Like a personalized game plan for your lungs.
Exactly. And it gives you more control too, which I think can be really empowering when you're dealing with a chronic condition.
Totally. It's like, okay, I've got this. I know what to do. Okay, that makes total sense.
Oh,
Having a plan, feeling empowered, that's got to be huge. But, when we talk about COPD affecting everything, it's not just the physical stuff either, right?
right. Better Living actually has a whole section on the emotional and mental aspects of COPD. And it's something a lot of people don't realize until they're dealing with it themselves.
Yeah, you think about the shortness of breath, the coughing, it can be scary.
Absolutely. It can be really frightening, especially at first. And that can lead to anxiety, even panic attacks in some cases.
So it's like this whole other layer on top of everything else.
Exactly. And then there's the fact that COPD can make it harder to do the things you enjoy. You might have to give up hobbies. Maybe you're not as social as you used to be. And that can definitely take a toll on your mood.
It can be isolating.
It can. And that's why Better Living really emphasizes the importance of support. Having people you can talk to, whether it's family, friends, a support group.
Makes a huge difference, right? Just knowing you're not alone.
Absolutely. And on that note, I have to say there's a whole chapter in Better Living that I was really happy to see, and it's about intimacy and COPD.
Oh, yeah, I was going to bring that up. Because that's something people don't talk about a lot, but it's a big deal.
It is, and it can be a really sensitive subject. Better Living does a good job of addressing it in a very open and honest way.
What kind of things does it say?
Well, first and foremost, it makes it very clear that intimacy is still possible with COPD.
Okay, that's good to hear.
It is. And they offer a lot of practical advice, like being open and honest with your partner about your limitations, trying different positions to find what's comfortable, even using breathing techniques to help manage shortness of breath during intimacy.
It's about adapting and figuring out what works for you as a couple.
Exactly. And the key takeaway there is that COPD doesn't have to mean the end of your sex life.
Right. It might look a little different, but it's still possible. So as we wrap things up here, I'm thinking about all the resources we've talked about, and it's a lot, both Better Living and a quick guide. Mentioned organizations like the Lung Foundation Australia, support groups.
Yeah. There's even stuff like Lungs in Action, which is an exercise program specifically for people with lung conditions.
I love that. So it's like you're not just handed this diagnosis and then left on your own to figure it all out. There's help, there's support, there are people who get it.
Absolutely, and that's what we want you to take away from this deep dive. Information is power, and now that you have a better understanding of COPD, you can take that and use it to advocate for yourself, whether it's talking to your doctor, connecting with others, or simply making one small change in your life today.
Absolutely. And if you're listening to this, chances are you're already taking that first step, which is seeking information. So kudos to you. And I want to end with this thought from Better Living, because I thought it was really powerful. They say small steps lead to big changes. So what's one small step you can take today to prioritize your lung health? It could be as simple as taking a walk outside, practicing some deep breathing exercises, or even just reaching out to a friend for support. Whatever it is, remember, you've got this. And that's a wrap on another deep dive. Thanks for joining us, and we'll catch you next time.